Thanks for the introduction, and thanks everyone for listening in today. The topic of today's webinar is Paying Healthcare Providers for Quality and Value, Key Trends and Star Law Considerations. If you're listening in, you're probably somewhere engaged in the process of paying physicians and developing models and arrangements that are focusing on incentivizing quality and value. If that is a role you're currently serving and you're not alone, many, if not most of the healthcare organizations I'm working with on a national level are taking a look at their existing compensation plans and are developing metrics, putting compensation at risk for quality and value metric achievement. And so if you're looking at that, then you're not alone. And that's what we're going to be talking about today, some of the mechanics of incorporating compensation around quality and value into your compensation plans, the regulatory issues that come with that. There are a number of them, and we have a very complicated regulatory framework to deal with. We have issues of fair market value and commercial reasonableness to think about and so on. But that is something that all healthcare organizations are navigating, and there's lots of room for innovation. And I hope that your questions are answered as the session unfolds. If they're not, please reach out to me. My email address is right there at the bottom of the slide. I would be happy to have a discussion with you about ways that your organization could incorporate quality and value. So we have lots of information to cover today. Just before we do so, just a bit of background on the firm that I work for, Hall Render. We are the largest healthcare-focused law firm in the country. Have developed a model where we have over 150 attorneys that specialize solely on healthcare. So we really have experts in all areas of health law on our team. And you know, if you ever have a question, I'm sure that we have someone on our team that's dealt with that question or specializes in that area of law, and we can get you a quick answer. My practice focuses almost exclusively on physician compensation, design, defensibility issues, and the development of medical group strategy. And so that's why today's content really dovetails with my practice. I spend most of my time designing comp models and figuring out ways to defend them and to document compliance. And again, that's why today's session is particularly interesting to me. Just to frame things up, here is our agenda for the webinar session. I'll start things off with some broader introductory concepts, some trends in the industry, issues around enforcement, kind of setting the stage as to why being thoughtful and focused on the regulatory piece is really important as you develop compensation models and start paying for quality and value. So we'll start off with those introductory concepts. Then we'll take a deeper dive into the regulatory standards. They're really important when you're designing any compensation model. Yeah, you know, you could design a great compensation model that incentivizes behavior, but if it's illegal, it's not going to do you much good. And as we'll talk about, an inappropriate compensation model can really open your doors up to liability. We'll talk about the value-based compensation, waivers, and gain-sharing models. We'll talk about quality performance incentives, developing best practices in the industry around these issues, and then we'll wrap things up with a Q&A. So we have a lot to cover more over the course of the next hour. My hope is that we can leave 5 minutes or so, maybe 10, for questions. Please be ready with those questions. They do add, and if you add to the content, to the quality of this webinar, and I'm sure that your questions, you're not alone with your questions. I'm sure others listening in will be wondering on the similar issues. So to kick things off, let's start off with some introductory concepts. I think we all know that healthcare reform is well on its way. When we look across the environment, we are seeing new payment and service delivery models, more of an emphasis on population health. bundled payment initiatives being advanced by the government, whether the BPCI program or CCJR program. Those are, new programs are being developed all the time. We've had the upswings and swings back on Medicaid. The development of the exchanges, expansion of those, and maybe some contraction more recently. More discussion about accountability and shared risk within models, continued consolidation, and that's all across the country. Systems are becoming larger. The physician enterprise, physician delivery models are becoming much bigger. The platform that healthcare organizations are looking at, especially from a physician standpoint, are much larger. We're seeing more focus on gain sharing models. We're seeing the discussion around the new quality payment